Hello, Camp followers! I am so excited! I've got the lovely Andrew Hale here, and today we're going to be talking more on the communication aspect of managing this chronic disease. So I'm Hannah Capon. I set up CAM 4 or 5 years ago and got very passionate about arthritis, and on my journey I've realized that so much more needs to be discussed and understood for us to really have a hope of managing this disease well. Something that we regularly get contacted about is communication. How do we communicate with owners in our care so that we can get the best for them and their dog? And something that crops up a lot, and is going to be the first part of our discussion, because it's going to be a 5-part discussion with the lovely Andrew Hale, who's going to introduce himself in a bit, is going to be how do we manage clients who really are finding it quite hard to come to terms with your diagnosis, your observations, your beliefs, and the denial that comes with it, and the difficulties at trying to get your information across. So we're going to come on to that in a minute. This is the lovely Andrew Hale. Yay!
Hi, Hannah.
Tell us a little bit about yourself and why I've invited you.
Okay, well, I'm a behaviourist, an animal behaviourist. But previous to that, in a previous life, I had a human psychology career, helping humans. So I kind of straddle that fence a little bit. Just a little point, I think what CAMs do is amazing. I think it's really needed. It's so necessary because we have to start thinking about things in the rounds. So whether it's working with dogs from a behavioural point of view, we've got to join those dots: neurology, physiology, as well as the behaviour and the learning theory. From a clinical profession point of view, our colleagues in the clinical profession have to start joining the dots around the fact that, you know, pain and behaviour is not different. You know, I hear that a lot. Oh, it's not pain, it's behaviour. Like the two things are separate. They're not. It's all together. So I think the more we can start talking around everything, the better. Because what we're looking at doing is getting the best outcomes for the dog and their carer. And obviously what we're discussing a little bit today is about the carer part of it. But that's what I'm really passionate about. I'm a real passionate educator, if you want to call it that, on promoting the emotional aspect of animal behaviour. Not just about the fact of what they've done, but why they do it. And pain, the nervous system, all these things have such a huge role to play in our dog's behaviour. Quite often with dogs with arthritis, it's quite often the behaviour that gives us the idea that there might be something wrong.
Absolutely. Well, the reason that Andrew's here is because you contacted me, and I suddenly found that I think we'd spent an hour on the phone, both being from the same song sheet, and we had really drifted from the academic path of, oh, it's to do with the joint, it's to do with cartilage, it's to do with pain, and we really found that we enjoyed talking about how can we help everybody involved. So today's episode is very much focused at the vet nurse, the therapist, the people that have got the skill base to identify pain, be it through behaviour, be it through posture, be it through physical changes. And they have made that connection that the dog presented to them is in pain. And they are now trying to communicate that to the owner, who often doesn't react as we would like them to. And I'm going to be blunt because I'm really good at that. This is one of the problems that we face, is that when you have a negative reaction by a person to you, it only takes a few times before your learnt behavioural response is, I'm just never going to say anything anymore, because the reaction that I'm getting is actually putting myself off going there again. And I know many vets on the topic of obesity and weight management actually think, do you know what, I can't face that again today. I don't need to have somebody's quite spiteful tongue, you know, abrupt manner, that starry eyes, the piercing look, the you don't know what you're talking about, he's fine. And it gets to the point you think, I'm just not going to say anything, because it's not worth it. I'm not going to get the result I want, and I'm actually going to suffer in the meantime. Why does that happen? Try and help us understand that you're imparting your wisdom, your knowledge, your experience to somebody else for their benefit and for the animal that they adore's benefit. Why are they likely to react badly? Because what I hope from what you say, therapists will go, I get it, okay, I can bear it, I'll try again.
Okay, well, one thing that is important to recognise is that vets and vet nurses aren't alone in this. It's shared amongst all the clinical professions. So my husband, for example, he's an end-of-life nurse. So there is a lot of very difficult conversations that have to be had sometimes. And the doctors, the nurses, the healthcare assistants will get very similar responses.
Right.
So it's not about the fact that you're a vet or you're a vet nurse. It's because you are somebody who is invariably giving information to an owner that either they weren't prepared for, or that they'd already been consciously and subconsciously battling with themselves pre that visit and are in a heavy state of denial.
Right.
So I think this is what's really important to recognise. There's a phenomenon called blame shifting. And it is a very important defense mechanism that we have, because when we think about our brain has to process information, and our brains are obsessed with outcome. We need to kind of recognize as an outcome, and an outcome that ultimately that we feel we have some control over. Right. There's something called the 3 C's, which I really want to come back to in a bit. I'll come back to those in a bit, or maybe in another video, because they're really important, control being one of them. So when the owner is confronted with that information, and actually I think in some ways, maybe you might be able to tell me differently, Hannah, but telling somebody about the weight of their dog is probably more difficult than telling somebody about the fact their dog's got a life-threatening condition. Because I think people take it very personally about the weight of their dog. Like the weight of the child, it's like, oh my God, I'm feeling bad mother then because I'm feeding you too much. But coming back to the blame shifting, it takes a lot as a human being to go straight away, oh, do you know what? I get it. Yeah, you're right. I'm going to deal with this. It's more of a reflexive response to kind of think, for your brain to think, right, there must be somebody else to blame here. It can't be me. It can't be anything I've done. It can't be my lack of awareness as an owner. Why didn't I spot that growth? All the extra things that kind of come into that. So blame shifting is a very common first response.
Right.
We learn it when we're very young. If you've got a sibling, it's like, it was her. It was her.
Yeah. No, I can raise that.
Because it's easier to shift the blame. Coming back to our colleagues in the vet world and the fact that they I get that as well. The fact that you get that negative response so many times and it kind of wears you down. But, and this might sound a bit controversial, but I'll go with it. I think it kind of comes with the territory a little bit. You are in the position as that professional to give that information to the client. It's far better to be expecting the fact that you're going to get a negative response rather than think that you should get a positive one, because they are. So
then you're pleasantly surprised when you do get.
Pleasantly surprised and do, and actually maybe even be a bit more concerned when you do. You know, if you've just said to a client, look, you know, your dog's got really bad arthritis, because obviously that's what comes about, and they're likely to be in a lot of pain. If the client is like, oh yeah, okay, I get it. Yeah, okay, thanks very much, I get it. You've got to start thinking, wow, have you got it? Have you got what I just said to you? You kind of want them to be a bit defensive. You want them to do a bit of blame shifting, because that kind of shows you, right, I've touched something in their processing circuits here, which makes them think there is a thing going on here.
Yeah.
So we can't be too precious about people's responses. Remember, behavior is primarily emotionally driven. We're all at the mercy of our emotional responses. Everybody will respond differently. So I think if we recognize that, then we have to think about giving information to people in stages. The problem, I think, in a vet scenario, in a human clinical scenario, these kind of moments are managed a bit better because there's more time to.
Glad you said that. Time is
you've got a 10-minute consult and you think, wow. But even then, you can still do little stages, and it's just a case of giving a little bit of information, a little bit of sync-in time, a bit more information, a little bit of sync-in time. And also to be able to offer solutions, even if they're small ones, even if they're a case of, okay, you know what, that's a bigger picture for another day, but here's something we can do today.
I think that's a really good point, in that time features so much in pain management, be it human or animal, and it is a really negative influence, be it on the examination, be it on the communication, be it on the time to effect. You know, time is the big badass when it is to do with chronic disease management. Everything takes time. It's a chronic disease. It took plenty of time to develop. We need to give it time all aspects of managing it. So I'm glad that you put that on, because I agree with you 100%. I think I love the fact that you've already given people a coping mechanism. So this is the aim of these clips, is to make people aware that you're not alone. We all endure this. We all have that starey face. That person doesn't want to know. They look at you as if you're talking gook, or as you say, they can be quite offensive. So you're not alone. It happens to all of us. You've given people their first coping strategy, which I think is so brilliant, which is expect the worst, because then you'll be pleasantly surprised. And I think that's how I am now. I must admit, I kind of go, breathe deep, it's going to be bad, and anything other is amazing.
And also having that little bit of empathy for the person, think, okay, you know, I've given you news that has come as a shock to you. And there are ways, I think there's a bigger picture here, Hannah, which is a whole big topic, which is time constraints on vets, period. And what it does to you guys. You know, I do behavioural clinics at some vets, and I get the luxury of a 20-minute chunk, and I only do maybe 4 or 5, and that's it. And I think, my God, you guys might do 30 or 40 in a day. Oh my God! But there are different ways. Thinking about, let's say, the trying to do it in stages, offering solutions, but also if you know that client's going to have some information, try and see if there's a vet nurse, or even a very supportive vet, one of the reception guys, or somebody who you can say to, right, so and so will have a chat with you now and just talk about some things that we can do now. So at least they don't feel that they're just being pushed out the door. So I think a lot of clients are like, wow, that was really hard to process, and then that's it, they're out the door.
Oh yeah, definitely. So just a little cam tip to help you out, guys, as well, is that the little business cards, I made them in many ways for myself, because I was getting more and more interested in arthritis, and I was having the face all the time. So I was a first opinion vet. I'd see people for a vaccine or a lump or an ear infection or a clipped nails, and they came in expecting something very, very different to what I was about to tell them of. It's probably had it for 2 to 3 years. There's significant muscle wasting because that's causing this, and this is what I can see, and we need to do something about it. And you could just see them shut down. So the business card was created with no sales pitch attached. I basically can hand it to them and say, this is a lot of information I've just given you, and I don't expect it all to be absorbed immediately. And there is this website that has been created to help you go read around it. It's all written for you owners. I go, it was written by a vet that spent quite a long time thinking about this. Have a read, and then come back to me. And I often suggest to people, I'm happy to see them free of charge for a second consultation to chat further. Or, as you say, I tend to pass them on and say, look, we've got a brilliant nursing team here. They're brilliant listeners. They often have more time than we do, so you don't feel so pressured. You know, they'll love to talk to you about what your thoughts, what your feelings, and then come back and see me. So CAM does offer that. Within CAM, there's loads of different sections to the website. There's the Facebook, there's the Holly's Army, there's booklets, the Own a Modular Workshop course. We keep trying to solve this problem. It's because it's wearing, isn't it? And resilience, how do us therapists, nurses, vets, behaviourists, where do we get this resilience from? I guess this video was for me to say, we're here behind you. Keep your resilience. Do you have any tips for people how to get the stiff upper lip and keep going?
I think there's a few things really. One is, this comes down to management of practices, fostering a culture within that practice where people can share and talk. I hear it a lot where especially practice managers are like, well, you shouldn't have got attached, you shouldn't have got connected, you shouldn't have got involved. But you know what? Staff will get connected, they will get involved. So if we say to staff you can't or you shouldn't, all that means is then that the vet staff means that they feel they can't talk about it when they do. So I think that's very important, having a supportive culture, looking at some form of controlled supervision within the vet practice. It doesn't take a lot, whether you have something done externally or internally. I think that can be very helpful. And also to remember that, it is a tough job being a vet, but being in care is tough. It doesn't matter what you're caring for.
Yes.
And you have to find ways, and everybody has their own coping strategies, but find their own ways of bringing yourself into the moment with the animal in front of you. Yes. Not still thinking about the animal you've just seen, not worrying about the animal that's still coming in. That is hard and it takes practice. And there's a lot of great resources out there. I could perhaps share them with you, actually. We can go on the CAM's website. That would be awesome. And also and having that self-care and checking in with yourself. And working out or making sure you can identify the difference between having those bad days and when something more fundamental is happening, compassion fatigue, burnout, all these kind of signals. That's perhaps something for us to talk about.
Yeah, and that's a future discussion, because I think I've dabbled in that. It was a few years back, and you know, your ability to manage what you would have found reasonably quite easy before, even decision make, or even be able to just put it into the context of something happening, and it just all goes, doesn't it? So I think that's a really good thing. If you find that you're able to cope in these situations and you think, I used to be able to, maybe, as you say, check in there. Is venting, are you allowed to vent, or does that make it worse? So if you've got we've got a CAM professional Facebook page that people can go and say how they feel and their findings, or does that make the situation worse? Is that a good thing or a bad thing?
I think in itself, venting is a really important thing, because we're a species that verbalizes. So getting stuff out there, whether it's to your colleagues or to your family or friends, the key there is it's got to be a safe space, because this is where venting can become. I see it a lot on some of the behavioural forums where somebody will say something that's a bit of a vent, but then people just play into the negative side of that, and it just becomes a whole thread of negativity. Because that's not what venting's about. Or whatever, you just got to say it in the moment. And the thing is why in a lot of care professions, many professionals develop a very dark sense of humour, because it's a way to actually say stuff that is kind of true, but we say it in a jokey way, because it's a way to kind of get some of that taboo stuff out there. Because
I'm so glad that you said that, because we did the Hills OA Roadshow last summer, me and Danny, well, this summer. Awesome. And one of the sections was a little bit of a funny black humour section, where the nurses we were teaching had a bit of a snigger and a bit of a giggle, because we all do it. And then suddenly I went, why do we do it? Because it's a coping strategy for ourselves. But we've got to remember, behind that wall of humour, those people still need our support. And, you know, quite often we will take the mickey behind closed doors, just as you say, to kind of get it out there. Before we leave this episode, something that I definitely want to mention, this isn't only a problem with the people that are providing the service, it's also a problem from owner to owner. And a number of our Holly's Army followers, CAM followers, have contacted us and said, this is actually pretty tough. I feel like you've opened my eyes to something. I'm trying to help others, and I am quite horrified at how people are responding to me. So I've got a dear friend who has started following CAM, and they're like, oh my God, I wish I'd known, I wish I knew that, I wish I knew this. And then when her fellow at work or a family member has said, oh, my dog, he doesn't do that anymore, he's just getting old. And she says, well, have you thought it could be pain? They've gone, no, it's not pain. And shut down. And she's even lost friends over it who no longer contact her because they don't want to hear it. So it can actually hurt, like owner to owner, can't it?
Exactly, and it's the same dynamics. So it depends upon the relationship between those two people. Anyway, there's so many factors to this, Hannah, when you think about it. It depends on the two individuals' relationships. Most often when people are very quick to dismiss something, that's because subconsciously they recognize it probably is.
Yeah.
So those defense mechanisms have happened way before that person's spoken to them and mentioned it. Because dealing with our own vulnerabilities, our own sensibilities is hard enough. And when you add in our loved ones, as in our human family, that's hard enough. When we start thinking about companion animals, it is no different. It is no different. In fact, it's probably even magnified a little bit. There's so many studies around people being more affected by the illness of their pets than they are by the humans. So I think as a lay person, if you're just somebody who's gone through it yourself, or you've understood some stuff, or you've been helped by something, and you speak to somebody else, they're equally speaking to that person's mindset, just like you would be as a professional.
Yes.
Some people need to hear it from a professional.
Yeah.
Some people will have more impact if they hear it from their neighbour. It depends on how they process stuff. But it's, again, it's about stages, and it's about sowing seeds. It's about,
Yes.
well, do you know what, just check out this website. And I would highly recommend to anybody, if you mention something to somebody and they seem a bit reluctant to hear what you're saying, just, like you say, write down the CAM's website on the back of a piece of paper and say, check it out. Because there's a good chance later when they're at work, they might think, oh, I'll just have a look at that then.
Yeah.
Because they can do it safely now. They're not being challenged. Their belief system, a lot of it's about belief systems, isn't being challenged externally now.
Yes.
They can do it privately.
And it's a really passive way to give people information. That's what we tried to do. Is we even looked into like the colour schemes that are inviting, engaging, not boring, but they're friendly, so that people won't see that business card or that flyer, etc., in a negative fashion. They'll see it's quite inviting. So yes, take home from this clip is we all know how you're feeling. So if you're watching this going, I can totally relate to this, you're not alone. Please keep your resilience. Please don't give up. This is so important. Just as Luna appears, don't give up, because the dogs depend on it. You know, it's really important to everybody at CAM and everybody that follows CAM that we help these dogs that are suffering from pain, that need to have it identified so that they can have a long, good quality of life. So don't give up. Look at your coping strategies, talk to people, don't keep it, you know, inside. You're allowed to vent, but do it in a positive manner. And use CAM. Cool. So we're going to see you tomorrow. We've got another one of these lovely interviews with Andrew Hale about anticipatory grief. So if you know someone that's been suffering from this, if you feel that you've suffered yourself, or if you want to understand it more to help clients, then join us tomorrow. See you later.